Good morning, everyone. Welcome to our virtual career day. My name is Carrie Hansen, and I am in admissions at Muscatine Community College.
Hi, good morning, everyone. I'm Kelsey King, and I serve as the admissions coordinator at Scott Community College.
And today is our veterinarian tech or veterinarian career session. So we have Erica Peterson, who is our vet tech academic advisor at Muscatine Community College. And we have Dr. Dan Drahos, who is the owner of Riverside Animal Hospital and our program director of the vet tech program at Muscatine. I'm going to read a little bio about him. He's also the president Executive Director of the Animal Emergency Center of the Quad Cities. Dr. Dan started in mixed animal practice until 2000 before committing full-time to small animal medicine and surgery. He led the Quad City Veterinarians into starting the EICC in 1999 and continues to act as head of that emergency hospital. Dr. Dan then moved to Muscatine and bought Riverside Animal Hospital in 2001. In 2010, MCC was searching for a veterinarian, and he and his wife joined on as joint program veterinarians. In 2017, he became the program director and now leads a great team of instructors at the teaching hospital. Dr. Dan very much enjoys seeing the graduates of the vet tech program evolve into valuable members of the veterinarian profession. He has too many hobbies to list, but is most known for his barbecue and his music, which is very true. So, Dr. Dan, thank you so much for joining us today. We're going to turn it over to you to start your presentation.
I guess we can do that. And I'm looking to the side, just to let people know I got 3 screens in here. And when I put my PowerPoint up, it kind of moves things around. So when you see me turn my head, it's not to get a cat off or the table or anything like that. So I'm going to share screen right now. Let me find the right one. Okay, is that sharing a PowerPoint? Okay, it is. All right, so to do this, I'm going to move my camera so I'm not looking to the side. And here's the rough part because the way I have it set up. All right, yeah, see, okay, because now to see you guys, I got to turn all the way over here, which is kind of weird. So anyway, we'll make it happen one way or the other. So thank you for the bio there, Carrie. And this is kind of a hybrid of a little bit of our vet tech visit days when students like you come investigate the vet tech program. And as I am a veterinarian, there may be some of you out there that may be interested in the veterinary field. So if you have any questions, I don't know how you want to proceed with this. If they raise their hand or ask one of you guys to in chat, and then you can prompt the question. How do you want to work?
Definitely put it in the chat, and then we will share the questions out for sure.
Okay, and you'll tell me because, like I say, I gotta get a crook in my neck to look at the chat. So so there you guys are. Okay, here we go. Yeah. I need to actually. You know what I'm gonna do? I'm gonna do this here. Hold on. We're getting these things set up. We're gonna move this one over here just a little bit so it's less of a head turn. There, that's less of a head turn. Okay. And I just got my camera disappeared somehow, didn't it? You guys hear me all right? Did that go away?
We can hear you, but we can't see you.
Okay, something happened there. My apologies. Let's see if I can turn this back on. Start video. Okay.
There we go. You're back.
Evidently moving the laptop hookup doesn't work. So anyway, hey, we just killed 30 seconds. All right, so we already got the little bit of a bio going on. So we'll go on to a little bit of a virtual tour of the 3 entities that I am active in: the Animal Emergency Center in the Quad Cities. For any of you in that direction, that's in Bettendorf. Facility we built about 10 years ago after being there for 20 years. And I have a virtual tour of a typical small animal practice, which is my clinic here, Riverside Animal Hospital. And then I got slides in school. Sorry, don't have a virtual video tour of that, but they're all kind of photo based. So if this thing works, and I'm going to, well, no, you guys can't see that, can you? All right, so I gotta change my share screen to a different share screen, evidently. That's what happens when you get 3 share screens here. Share screen. I'm gonna move this to this other screen. Good thing we're doing this before people are on. Okay, there we go. I gotta move to the middle screen. Find my mouse here. There. That's sharing, isn't it? Okay.
We can say that. Perfect.
Okay. There you go. That's the Riverside Animal Hospital's website. So we have on here just kind of a look at a virtual tour of what a typical small animal maybe practice, or at least typical here at Muscatine. Of course, you know, the front desk, whether you're to reception, checking in, checking out for the text, but that's kind of the hub of the facility where people come in and people come out. You'll probably notice if you've been to your veterinary clinic these days that the front desks, well, maybe if you can get in these days, we'll have plastic, you know, right now we have plastic sheets hanging out like a lot of places for the COVID era. So let's go to the next room, which is the treatment. So this is usually kind of the hub of the, oops, I went too far. There we go. The hub of veterinary practice, and you'll see the difference between this one and the Animal Emergency Center, where this is where all the treatments, hence the treatment room goes. You have a nice wet table where you can do procedures, flushing of abscesses, even dentals, and some non-sterile procedures can go in here. Another table for other exams, you know, treatments that don't need to have water. And then all your pharmacy type of equipment and treatment. So you have some drugs, some a locked cabinet for some, you know, control drugs, treatment stuff. I think I can even zoom in. Yeah, there you go. And all the things you need: flushes, eye meds, cleaners, dental machine. You have some surgical equipment, other bandages, and then inside this, if I can get this thing to move correctly, this cabinet is a lot of the treatment stuff. Then if you go back further to let's go. Oh, it just wants to zoom in and out. Okay, I practiced this earlier. Trust me, there it is. Okay, so there's a surgery room. I'll go into it a little bit further. So here's a surgery room. This is actually a pretty large one for most practices. We could put 2 in here, but you have an ultrasound machine, a surgical table. I am known as a laser vet, so we have a surgical laser, anesthetic equipment, and then around here you have all the instruments that a technician, veterinary technician, would be using to do anesthesia. So anesthesiology in the vet tech program is all about this little corner here. You got your machines, your monitors, your sutures for surgery tech, different blood pressure cuffs, there's fluids and all this kind of stuff in the back here. And of course, probably the most important thing in any surgery room is the music. You got to have music in a surgery room. At least Dr. Dan is. Let's go back out. This is still more the treatment area. You can see some muzzles, and we have some cages and stuff in there. Let's go back out to the treatment area, or to the reception area. And we have exam rooms in our practice. We have 3. There's actually 2 up on either side over here. A lot of brochures for the clients and education. And then we don't have it into the back, I don't think, or we kind of do that far. In the back is a pharmacy and the lab. So if you're into all these things I'm talking about as far as in the clinics, you will see when I talk about veterinary technicians, what they do and what their roles are, as well as veterinarians, it comes into those areas. And like Erica and Carrie have heard me talk about all the things that a vet tech gets to do. So this is a good picture of in the exam room where we have just kind of basic equipment for the vet tech to get their pre-exam and history done. And the back is where all the lab machines for blood work, fecal work, urinalysis, refrigerator for all the vaccines and stuff like that. So with that being done, I'm going to switch to the animal emergency tour. Animal emergency in Bettendorf is staffed by 4 veterinarians and about 30 staff. There's a board of directors. There's 5 of us as board of directors, of which I'm the president and the executive director. And but the guts of it are really the technicians. The doctors obviously do all the work as far as the things I'll talk about later that they need to do. But the technicians get to do everything else, and they are the really the key factor into a busy facility like this to go. So this reception, you can tell, is much bigger. looks much more sterile because they don't have to worry about some of the things on the walls, like here's how to vaccinate, here's how to deworm. They just need to get you in and out. They're not really there to educate you about your welfare long term of your pet. Nice big waiting area for multiple people. Big desk area there to get you all set up. So let's move a little bit this way and go to the back room where all the fun stuff. Look at this treatment area. I'm going to back up here a little bit. This treatment area is very large. Obviously, we have lots and lots of cages for hospitalized patients that need to be watched intensively right off the bat. Some big areas for treatment. You have one wet sink on this side. We actually have two on the other side. You may be able to see this one lifts up and down for lifting up bigger dogs. And this has a lot of drop ceiling things for like oxygen and anesthesia, waste gas. Many, many lights hanging from the ceilings for doing closer treatment exams, and then a bunch of computers for the technicians to do all their chart entry and stuff like that. And in the back here, we have a little bit further back. This is our prep area for surgery. It looks a little bit like the prep area in a small animal practice, but it's dedicated just for surgery. You have a pass through here to the surgery room where you can, or window, you can pass through some equipment and surgery, sutures and stuff. In the surgical room here, we could fit two in here because there's two gas waste things, but we keep just one surgery at a time most of the time at our emergency center. And this big piece of equipment back here is a phacoemulsification. We have an ophthalmologist that comes up there 2 times a week. So that's for doing cataracts. So we have a lot of ophthalmology type equipment up in this area, very expensive equipment that he comes up to do his specialized work. Going to across the hall into this room is our imaging room. So we have a nice digital x-ray. You have some ultrasounds, you have endoscopy, and some dedicated computers for this piece of equipment here. You can see it's a much bigger facility, a little more expensive equipment in here. And I don't think I can go to the back of this room, but I'll go this direction. And you'll see over here is the big lab area. We have 3 blood machines, a lot of drugs over here, and a cooler, and a nice oxygen cage, and actually small infant, or in our case, we use this infant one for puppies and kittens, or small, cats and stuff like that. A lot of hustle and bustle happens up in here. And then we have some other wards in the back here. This is, I guess I went down the hallway. Let me go not up the hallway and one more time before I go into the cat room. So we have a cat ward and food prep area. And then across the hallway, you have the dog ward that we don't have to watch and be under intensive care. And then the last couple rooms I'll show you here is, this is our intensive isolation. So if they have some disease like corona, our version is parvo, or upper respiratory contagious diseases, they can stay back here in isolation. They have their own oxygen and not infect any other patients that are out in the hospital. I'm going to slip sideways down a hall into a typical exam room. If I back up here, let's turn around this exam room. So a couple nice chairs, and we have our own computers in every room. So basically that's the emergency center. Any questions from the staff, the students, the watchers? So we got the virtual tour finished. So I'm going to stop share and see if I can, again, whip my mouse around to start share a different screen of the virtual tour. There we go. So I got that one back. Everybody see that screen okay? Then am I back to the right one? Okay. I'm going to switch my camera to look into this one with my head chopped off. There you go. All right. Hey, we made it through at least a little bit of that switcheroo website thing. All right. So the school. So here's the pictures I took yesterday. You can tell because it's gloomy out and rainy as it was this time of the day yesterday, but at least it wasn't raining. It is at the Agriculture Learning Center, which is on the bypass of Muscatine. Many of you from the high school program, if and when you watch this, you will recognize this because it is a high school joint adventure. Actually, they started, we kind of lopped on like like I don't know, one of those more remora fish, whatever, on the bottom of a, anyway, analogies. You have to look that one up. Like a barnacle on a whale. How's that for analogy? Anyway, so they have I didn't take pictures of the big arena out there, but there's a large animal section, but I'm going to focus mostly on the vet tech program portion of this facility. You'll notice the new sign that came out a couple years ago because there's really nothing in the buildings. So this sits out front of Lucas Street along the bypass where the John Deere dealership is. Inside there, I took a bunch of other pictures, but there is in the back section, and the back section, this little picture to the right here, where there's some kennels. We have our own entrance in the back. If we go from the outside, for the dogs to walk and the students to go in this back door. But from inside the building, we have our own MCC, Vet Tech College entrance in the back to our teaching hospital, which I'll show you a couple pictures in a second. The classroom is equipped to be not only a lecture room, but also a lab room. I can't zoom on this, but in the back there is a lab area where there's no eating, where we can do some microbiology labs, some fecal urinalysis labs and stuff like that. You can see a culture and incubator in the back here. But otherwise, it's you can see right now it's equipped for COVID spacing for labs, all 6 feet apart, which someday will get to be closer. And so then in the back there, we have a couple different wards. This is the cat ward. You see it's nice and cozy. They have little condos that they can stay in while they're here. And then we have the dog ward, which is more of the metal cages and bigger runs where they can go outside, where you saw with a caging area where they can go for walks and such as that. A smaller lab area for doing some blood work. We have a couple computers that you can't see except for the keyboards to the left there, and the cabinets for records and some other equipment in our lab area in the teaching hospital. And then this is a smaller version of the guts, the treatment area. You saw the 2 versions from Riverside, and you saw the version from the Animal Emergency Center. This is a little bit like Riverside, only it's got one wet or dry table, another dry table, and much the same equipment that you would see at the small animal practice. So our teaching hospital does emulate a contemporary working hospital. So everything you would see in our teaching hospital, you could practice medicine. Other than we just don't have as many different drugs and stuff like that for treating diseases. But we have everything you need here. To the left is an autoclave, and there's clippers, there's all kinds of otoscopes and stuff like that. And then here's the teaching surgery room. We have set up for 2 surgeries at one time. We have the lights, we have anesthetic, monitoring machine, and you can see this little camera up on top of the ceiling. So we have closed, not closed caption, but closed system audio visual, so anybody in the classroom can also watch and listen to what's going on in the surgery room. So there's been more than once where we've done some fun surgery, so we couldn't fit everybody in here, so they went to the room and they can move the camera from the room and zoom in, zoom out, and pan around and stuff like that, and actually watch the surgeries. So there's the 3 tours of the 3 facilities that I'm involved with, and 3 different aspects of veterinary medicine and veterinary technology. So as budding young pre-college students, juniors and seniors, correct? As I'm turning my head this way, okay, see the nods, so Gary. So as you're deciding where you're gonna go, hey, I love animals. We'll talk a little bit about loving medicine too, and science and math and biology, all that kind of stuff. But whether you want to be a veterinarian, a DVM, that's a doctor of veterinary medicine, versus MD, which is medical doctor, or a veterinary technician, which is the same equivalency, so to speak, as the human nurses. In fact, I talk about it in my vet tech visit days, which is more in depth. They are considering in a lot of states and maybe around the country or world to changing it from certified vet tech to a registered veterinary nurse, because many people don't understand how much technicians do. They are nurses and then some, as my esteemed colleagues nodding their head. Yes, they've heard the speech before, and I've got them all understanding, brainwashed, acknowledged, their eyes been open to what all vet techs do. And Kelsey's going to learn a lot here today too. Certified vet tech or a registered veterinary nurse, just to let people understand, people, meaning clients or even owners like you as high school students, to know really what all of that tech does. It's pretty amazing. And I actually was even more enlightened since 2010 when I started teaching the program, even though I was in practice for 17 years, how much we need to put into those heads of yours going through the vet tech program. So what duties must be done only by a licensed veterinarian? Where in other words, a vet tech or a vet nurse cannot do these. They can't diagnose the diseases, even though they know what they are. I love when my staff say, oh, I know what's going on, but they just can't tell the client until I give them the go ahead, even though no, they know what's going on. They can't actually prescribe medicine, even though they certainly know what medicines go with what diseases. They just don't have the license to actually make a prescription or prescribe that antibiotics, prescribe that pain medication, prescribe whatever to that patient. And of course, they cannot perform surgeries. They can do sutures and stuff like that, bandages, and even dental cleanings and all that kind of stuff. They just can't do anything that is technically a surgery. Only those can be done by veterinarian. That leaves a whole lot of things that they can do. So I got a few extra pictures on here. Of course, one of them is the classic one they think as owners and clients think that vet techs do, is they think they hold animals. Well, they do. You can see these are 3 of my technicians at Riverside Animal Hospital. All 3 of them students and or graduates from the vet tech program, having just kind of a nice little wrangling of these dogs to left side. And then, as you can see, again, there's 4 employees of mine, all graduates of the program, doing an enema on a cat. You notice I'm just taking the picture. I don't need to do that. Let the technicians do that fun stuff. In fact, ironically, they're doing one right now at Riverside Animal Hospital dog that I need to do a bleeding polyp for. You can try to put the pictures together, a surgery when I get back. So there you go. Some graphic reality of what veterinarians do. They have to do that so that wait for me to get back after this to actually do the surgery to try to remove that polyp in that dog. Here's some other students doing some restraining. These were students from a few years ago. And if you can see what's happening in the middle of this sedated / not really restraining, but they're doing a blood transfusion. This is actually bloodline. You can't see the bag of blood, but yeah, they can draw blood, they can type it, they can cross match it, and then they can administer blood transfusions. Veterinarian does not need to do that, and that's one of the things we have to teach. You can see some radiographs taken in that one to the right. These are all the vet tech program, by the way, during our teaching lab. So they are doing x-rays or radiographs on that patient. And this one, they are doing a dental procedure. So you can see this is post-COVID, where we're wearing our shields and stuff like that. The one on the left is she's actually a student running anesthesia, checking the monitor. I'm just kind of, pointing the direction and making sure they're doing the dental cleaning, prophylaxis, and everything correctly. And I had taken a picture from the other end of the view where you can see the cat here and doing the dental procedure. And then there's large animal bandaging. This is one of our large animal labs out in the field where they are doing bandaging. They're practicing blood draws, injections, oral medications, tail wraps, all kinds of things, physical exam on large animals. So that's one of the fun things we do at our program. In fact, we just did this yesterday. And this is not the picture from yesterday, but we took another picture very similar. They like to pose with all their newly bandaged patient out at this pony farm. And then here's a fun example of the surgeries for veterinarian part. This is a pre and a post. This was a dog with this is not a cancer. This is just excessive gum tissue. And just to show you the fun gratification or satisfying procedures we could do. And my technicians all thought this was the most amazing thing because they do dental cleanings. They can't really do a dental cleaning on this pet because look, you see one upper canine tooth, one lower canine teeth, and 2, maybe a third one popping through. And I went in there with my laser to clean this dog up and look at, he's actually got teeth underneath there. They're pretty amazing, isn't it? So once we get that surgery done, this dog can finally chew. By the way, the previous picture, there's blood in there. I didn't really do any. That dog is bleeding because when he's trying to eat, he's chewing on his own gums. So by the time we get all done, you can see there really is no bleeding with laser. We exposed all those teeth that were hidden and couldn't see. So that's just a kind of, I know some people going, oh, blood, oh, cool. But this is just kind of fun stuff that got me into veterinary medicine, to be able to do this because the surgery is cool. Not specifically because I loved animals. I loved doing this sort of stuff. So there we go. Because as a licensed vet, I can do the surgeries and make some of the techs jealous, but there's a lot that goes into that. Just check to see if I need to hopping on. By the way, if you guys have any questions, just barge in, because that's usually a question time. So I will answer the theoretical question that some students would ask is, hey, I want to be a veterinarian. It sounds like you can do more things. What's your advice, Dr. Dan? Well, first things first, and this is what I tell a lot of the students, and many of the young ladies here have heard this before, is you want to go into veterinary medicine because you really kind of love medicine and science first, animals second. When I got to vet school, the first thing my professor said at orientation, he said to all of us 110 veterinarian students out there, says, if you're here because you love animals, there's a door. You can leave right now. We're not here because we want you to love animals. We want you here because you love the science, the medicine, the surgery, all that stuff that comes to make a good veterinarian. What makes a great veterinarian, of course, then is you want to do that on animals and have that compassion for animals. And that's exactly what I was. I love doing stuff. I just would rather not do it a human. Plus, I can do a lot more, which comes to this. All these things we can do as vet techs and veterinary duties: nursing care, examining treatment, anesthesia, surgery, lab testing, dentistry, imaging, nutrition. You get the picture, all these things, practice management. When you get into the human side of things, you usually focus on one sort of thing, especially the nursing. The nurses, they tend to go into one situation where, hey, I'm going to be a nurse at a nursing home, nurse at a dental office, nurse at an anesthesia, nurse in surgery, nurse in general practice. But in the veterinary field, if you're in general practice, you get to put on all these different hats every moment of the day. Now, the difference is, as a veterinarian, I want to be a veterinarian. So my advice is, yes, it's great. You get to dive in more, do those three things I said earlier. But right now, and I'm going to have you go and tell your parents this. Uh-oh, here we go. Here's a message to your parents. I want to be a veterinarian. I talked to Dr. Dan's thing. I said, I even want to be a veterinarian more. Prepare yourself now, if you have not, when you were 5 years old. I know you weren't preparing for your 5 years old, but hopefully your parents were. It is a big financial investment to become a veterinarian. So here I'm going to talk about money instead of medicine. So it isn't just simply, I love animals and I want to be a veterinarian. You come out of vet school with at least $100, $150, sometimes $250,000 in debt, unless you are prepared ahead of time. So not that I'm trying to talk anybody out of that. You can sure take loans and have a tough time struggling financially to pay those off the rest of your life, or hopefully your parents are preparing you now, where that's through putting money away, helping pay for some of the, at least the undergrad stuff, or get you prepared for some of the FICA type, not FICA, but the stuff that Erica helps me deal with as far as the financial aid stuff. But I encourage all budding young veterinarians to try not to rely on loans to get through vet school. Whereas the vet tech program, you get to do all this stuff in only 2 years versus 8 years, not have that financial burden afterwards, and still get to do what you love, and that is to do medicine and practice with the love of animals. How's that? Have you heard that end of it before, Erica? That's kind of new twist on these budding high schoolers interested in that. So all those things that kind of relate to these things you need to do, all those professionals, whether it's a veterinarian or a technician, deal with. Pharmacology, anatomy and physiology, chemistry, biology. You see these first two, chemistry, biology, they are prerequisites for the vet tech program. And definitely if you say, yeah, I want to be a veterinarian or vet tech, but I'm really not good and hate chemistry and biology and math, you're going to struggle. I'm not disrespecting you, but you're going to struggle, because all these other things you see below that, pharmacology, micro, physical exams, imaging, you have to have the basis of this and math to be able to get through all these high-end classes. And I can tell some of the students that don't quite make it or struggle because they don't have a good foundation and grasp of some of those basics. So that's my scare. Math and science, big time, is the foundation of success, as well as any education profession, whatever, the English, the reading, writing, talking to the clients, writing instructions, understanding those sort of things. So that's the sort of things to prepare yourself for if you're looking in the veterinary field, whether that's veterinarian or vet tech. Recommendations now, if you're still considering that, yes, you're getting a potential 1 hour view of behind the scenes at the vet tech program, an emergency center, and regular practice. But I will go out there. Even in high school, we do have requirements to get into the program as far as some world experience, clinical experience. But just go out there and see really, hey, maybe you have your own pet and you love animals and think you want to be in this profession or do want to be in this profession. Go out and see what the real thing is like. There are some things that are eye openers. And since we've been requiring this to get to the vet tech program, we've been pleasantly surprised, the eye opener. And 99% of the time, it has actually not only opened the eyes of the potential vet techs out there, but also solidified, yes, wow, I didn't realize we got to do all that stuff too. Now I really want to do that, but at least they have a realistic grasp of what they're getting themselves into, which is fun. So to become a vet tech, 2 years, it's a 2-year applied science degree. And of course, we at Muscatine have a great program. Go and program review even today, this afternoon. So we're very proud of our facility. We have great instructors, some very good facilities. They got a so-so veterinarian. He hangs in there and does all right. And to become a veterinarian, it's either 3 to 4 years of undergrad study. I think they've actually reduced it, so maybe you can even cram it in 2 years. I do not advise that, but you can do it in 2 years. And then there's 4 years vet school. Why, Dr. Dan, 2 years? It shaves 2 years. I think there is something to, and here's my fatherly advice to you young students. Try not to say, I want to be a veterinarian. I want to get done quickly. I'm going to do 2 years of undergrad, pre-vet, 4 years vet school, and then do the math, 24 years old, you're out as a veterinarian. You haven't even lived life yet, folks. Spend some time in college, do a 4-year degree. I did, and you get to be wiser, more wisdom, living on your own instead of all of a sudden study, now you're in the real world with $150,000 of loans, and now all you're trying to do is pay the man to get your loans paid back. Now I come back to the money, but there's something to be said in actually, traveling around, taking the 4 years to get your degree, and that sort of stuff. So that's my wisdom on that. I see some of these young graduates come and yeah, they may be great veterinarians, but I think a little more maturity, a little wisdom in the world, I think would help them out to relate to people. Because being a vet tech, being a veterinarian, you still have to relate to people, even though you're working with animals. Regardless, whether you do the 2-year vet tech or, the 6 to 8 years being a veterinarian, they both require a big exam at the end, a board exam, and to actually become a certified and registered technician or licensed veterinarian. So that we prepare you with our schooling to hopefully do that. When we get through that, all kinds of career options. You don't have to just go into general medical practice, which is the typical thing people think about. Hey, I want to become a vet tech, work in a practice. Great, we'd like you to be there. We'd love you to stay there for more than 7 years, or become a veterinarian. Same thing. We'd like you to go there. We'd like you to be there more than 15, 20 years. There's a great shortage of veterinarians these days because I don't think they're staying in the field as long as they were many years ago. Same thing with vet techs. But you can go to specialty practices. Hey, maybe I just want to do cat only. Maybe I want to do exotic animals, stuff like that. And then there's zoos. We have a couple that actually explore the zoos and still may do that. We have a good relationship with the Henry Dorley Zoo in Omaha. We've had 3 of our students go there and had a very, very good time. Learned a lot, and the zoo said, send more Muscatine grads because they like our students. They're very well prepared, and I'm glad we have bonded and forged that relationship with that facility. And I love going out there to visit my students when they're there. Of course, you can work at a college university. We have 2 technicians working as adjuncts right now. One of our adjuncts, full-time, Michelle Nigg, she was at Iowa State University in surgery and anesthesia for many years. So she really got to help with the students there. We have 3 of our graduates that are right now working full-time at Iowa State University. yay Muscatine. So they're doing very well down there too. One, I think, is actually even going to become board certified, which I think, well, it's not on this list. She wants to go become a board certified continuing education in technology to become not just a technician, but a technologist and board certified in the large animal anesthesia and surgery, which is awesome to have that student go on that far. Research, biomedical. I darn bet you in this whole world of COVID, there are some veterinary technicians somewhere in all that research field helping them out developing those vaccines. They got to try them on some things. They do cultures. We had one student that worked in a blood lab, a human blood lab at University of Iowa. That's biomedical, and doing some research and prep for the Iowa Blood Bank and stuff like that. Military service, we have veterinarians as well as technicians in the armed services. We have to take care of those service dogs and that sort of stuff, and horses and whatever the military services need. Falcons, I guess, maybe. Food safety inspection, a lot of those in the USDA and working in the government field. Diagnostic labs, a lot of them at Antech, which is a big diagnostic lab around the country. And maybe you're not a people person. Maybe you get the heebie-jeebies still after going through a vet tech program. And we had some of those that still kind of had a little, would just work confident with the animals, stuff like that, knew all the skills, but really found their niche working in a diagnostic lab. Or vet sales. We have a lot of our technicians. I think part of the reason they kind of fade out after 7 or so years is they find, hey, I can, work for, Pfizer, work for Zoetis, work for one of these big drug companies and lab supply companies, and be a representative that goes around teaching other vet clinics and stuff how their products work. So those can be very good. Of course, humane societies, drug and food manufacturers, kind of same type of opportunities. Clear my throat with low coffee. All right. Hey, we made it through in almost 40 of the minutes. For questions, comments, songs. Now that I've gone through that, and I'm going to undo my thing so I can.
Dr. Dan, I've got some questions.
Yes.
Can you talk about the hours for a veterinarian, for a vet tech? Are they typical Monday through Friday? I know yours are. You're involved with a lot. So you talk a little bit about that.
Okay. Very good question. It kind of depends on where you're at. I'll give you the typical hours of a regular vet clinic and then the emergency center, because those are quite different and unique. 40 hours. We try to typically keep them to 40 hours. You get some big clinics and they have to keep them extra. I will tell you, my emergency center right now, Quad Cities, bless their hearts. You talk about, if you know anybody up there, if you're ever up there, give kudos to their veterinarians, vet techs. They are working probably 60 hours. And they're getting paid for it well too. With the COVID era, it's been very busy at all the emergency centers in the area. And we're understaffed and over-houred, where they're getting paid, but my employees at the emergency center have not had a vacation in a year and a half. We end up paying out their vacation time at 2 times because we felt so bad that they just couldn't afford to have them go away. So that they have a lot more hours. Now, granted, depending on what kind of emergency facility, if you decide to do that, and whether 24 hours or just like ours, which is evening, you will need to be prepared to work, evening shifts, weekends, holidays, stuff like that. Again, that's where the biggest pay comes in as far as compensation. And there is a certain grit of a technician or a person that just loves the thrill of that excitement of an ER and the satisfying of saving those animals that are in that dire. You see some amazing big end things up there and get to be utilized as a true emergency medical professional at a place like that. So those are long hours. And like our practice, typically they'll be Monday through Friday or Monday through Saturday, having one day off in there, getting in your, we try to schedule, 35 hours a week. So if they are long in a lunch hour or later in the day, they're still that 40 hours a week. So now if you go to places like those other fields in government, industry, whatever, you're pretty much a 9 to 5-er, the corporate hours and research and stuff like that. So does it help you answer your question? As I'm turning.
Yeah, absolutely. That's interesting. Can you talk a little bit about, We know students like to know what am I going to make? What am I going to make? And so can you talk about that? I know it's hard, depending on where you go, but how about some starting pay?
You're psychic, because I was going to say that if you didn't ask it. So one of the things that I did not put on this slide, which I have from my vet tech visit days, as a vet tech, the national average is about $15.50 an hour, which is about $35,000 in a year in salary. Midwest, you're a little less than that. It's more $13.80 to $14 an hour, because we have a lower cost of living here. Of course, the coasts are going to be higher in the bigger cities because of the need, and of course, the cost of living is much higher. So average $15 an hour. Again, but still in Iowa, it depends on what kind of facility you're at. I say that in the classic number I like to throw out is one of my technicians, who's also like a floor manager, depending on your duties and all that kind of thing. She's making $55,000 a year at the Animal Emergency Center, well above the national average, but she's very valuable. She is salaried. She is working definitely more than 40 hours a week. But she has those skills and management stuff to do that. So yeah, there's a range depending on what your skills you have to bring to the table, the longer you're in practice and getting that credential. Veterinarian, it's pretty tough to guess that. I haven't looked at the stats on that this year. A new grad coming out should be able to expect to be able to make, $70,000 to $80,000 a year, which is much less than their human counterparts. As you go out, that ranges and grows up. We have a lot of things called pro sal, which is you have a salary plus production. So it depends on how good of a veterinarian you are, if you could produce for your company. And I'll just tell you right now, Riverside's looking for one, and we're going to pay $80,000 pro sal. They should be able to make well over $100,000, which is in just this little Muscatine area, which is pretty good. Nationally, you probably be equivalent of $150,000 for a veterinarian. So that's kind of what we're looking at.
Definitely, you have more school, but you have more student loan debt as well. So,
and so what
go ahead.
No. So to finish up on that, we have kind of a saying in the veterinary profession. It's kind of our joke. Why do we go into vet med instead of human medicine when we have to work 7 times as long, 7 times the species, for 1/7 the salary of a human medical doctor? And there kind of is a little bit of that. They say 7 because of species, but certainly we don't get the compensation as maybe human nurses do and human doctors do. But we just enjoy ourselves a lot more. I think we're respected for that. I go in every day and you, like technicians, instead of seeing the same old thing day in, day out, I get to see a mouth. I'm a dentist. That's all I see all day long. Or maybe I'm an orthopedist. All I get to see is elbows all day long, or ear, nose, and throats, or you name it, do the one thing. Even a general practitioner, they may see more things, but they have to punt off the surgeries and the dentals and the fractures. We as veterinarians, I can put a hat on one moment and do something fun like that polyp I'm going to take off. Yet I get to see a puppy. I have to do a sad euthanasia on that older dog. I get to do dentistry. I get to do that fun things that keeps everyday excitement to keep us going. And plus we like the thrill and the joy and the compassion we can deal with the clients and their pets. So there's that give and take that you have to realize. Job satisfaction isn't always about the compensation. And I'm not just saying that to make excuses for our lower pay. It's not low. It's actually not too bad. But why we aren't in the human profession. So
yeah, that's a great point. I was going to ask that as well. Erica brought up a question that I know you can talk about is, what does the job outlook look like for vet techs? Is it easy for your graduates to find jobs? Is it something that a lot of people need? What is the outlook for that?
It's more than you can imagine. And I know you kind of knew that was going to come as an answer. Sorry, I moved my screen again. As the program director of this vet tech program, and how well I'm connected with the Quad Cities in Eastern Iowa with all my emails and the clinics that come down the emergency center and whatnot, I average probably one time a week where somebody's asking, I need a graduate, who do you have? And my answer is, sorry, they were all spoken 8 months ago. So the need is tremendous for vet techs right now. we could easily graduate 5 times as many and have all jobs. Now, it's up to the student whether they have what it takes to to hire and all that kind of stuff. We will get them through college. We will teach them the skills, the soft skills, the medical skills, stuff like that. But still, everyone can have a job as long as they have a good package put together, not just education but personality and all that kind of stuff. And yeah, they're screaming for them out there. We can't put out enough. There was I can't remember which study was done, but yeah, the outlook is for the next 10 years is we're going to be needing them like crazy. And we will. I see that. Same thing for veterinarians. For some reason, we are shortage, even though we're putting out tons and tons of them. I myself have been looking for a veterinarian in Muscatine, Iowa for like 8 years, and I haven't found one yet. They're getting snagged up and gobbled up by the big corporate ones, and little practices have a tough time. So we can use veterinarians. And I think we're having a burnout of those, so they're not staying as long. I think there was a generation, back, 20 years ago where the veterinarians and they're usually the old timer guys, they work until they're 90 years old. And now with more of a gender spread, they're dropping out earlier, choosing part-time and stuff like that. So we don't have longevity in the veterinary profession. So we're needing, because there's a faster turnover right now. So yes, we need veterinarians too. Long answer, sort of, not really, but it's the answer.
Dr. Dan, I have a question here for you next. So you mentioned, the license, taking that board exam. So what type of continuing education or just additional certifications do you need, maybe initially or throughout your career?
That's actually a good point, and you're intuitive on that. Yes, you do have continuing education. Veterinarians is basically 20 credits a year. Technicians is 10 CE, continuing education credits a year to keep your license going. And that's the interesting thing about vet techs versus, I'm sure human nurses do, but when you're in the vet tech field, that continuing education is so much more important because, okay, I need to get my education. Oh, since I'm doing 20 different hats, same like a veterinarian, I need to be continuing education about dental procedures that are up and coming. I need to do about the new X-ray procedures that are coming up. I need to do about the new medicines that are out, the new diseases. So they have to really spread their education out because they've got so many hats they're wearing. So it's even more important not just get that 10 credits, but keep doing those things because you don't want to come out of the vet tech program, know how to do this stuff. And then our industry changes so much because we do so many different things that you need to be up to date. What's the new prevention programs out, the new drugs for deworming and heartworm and vaccines and stuff like that. So it's a lot more education in the veterinary field than the human field. I will tell you that right now. And I'm no bones about it. It's not disrespect to humans. There's a lot more we have to cover and keep ourselves up on.
Well, this has been great, Dr. Dan. Thank you so much. I know we've got about 10 minutes left, but I know as
you want more education?
As a fun little wrap up, Dr. Dan is a musician and he's quite good and he writes songs. And so Dr. Dan's going to lead us out with one of his songs.
Well, now the question is, do you want me to do the new one? Or I'll do the first one because it's funner.
Do whatever feels right, Dr. Dan.
Okay, for you students listen to this and your instructors, if you're in agriculture, you will recognize what I'm about to sing about. It's an educational piece about swine management. Okay, here we go. Well, I'm a little piggy in the fairweed crate. 12 other brothers and sisters I hate. Every time I belly up to the buffet, my big brother sisters push me away. I get bumped, bump, 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 bump to the back of the line. Now I'm a little piggy that's sucking high teeth. I drive and I kick it and you milk a bit. Every time I move away to the front, I never quite make it because I'm a runt. I get bumped, bump, 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 bump to the back of the line. I'm starving, I'm weak, I'm wasting away. I ain't gonna make it another day. The farmer better help or I am through, and I'll be feeding all the maggots in a pile of poo. Okay, that's gross. But it's the point I'm making about runt pigs. Well, sometimes those mama pigs got a lot of little babies, and maybe 12, 14 pigs. Well, they got only so many mammary glands on that feeding trough. And the pigs learn real early, baby pigs learn really early, that those front mammary glands have a lot more milk than the back mammary glands. So those big old piggies, those 10-pound piggies, learn to push their way to the front and get those big milk jugs. A lot more milk. And there's something called teat order. Well, those stronger pigs move to the front, they push those little pigs to the back. And then next thing you know, that little pig is sucking hind teat. That's where that terminology came from. Well, that little teeny runt that's sucking hind teat starts to starve and eventually fades away and dies. That's bad. So we got to do something management. We do something called cross-fostering. We take that little 5-pound piggy in a 10-pound piggy world. We find another litter, another crate. Maybe that sow just had babies a week later, and they're all 5-pound pigs. Get the picture? Now we take that pig, move it on over, and now we've got a fighting chance. Well, I'm a little piggy with a new venue. I got new brothers, sisters, and a new mama too. Now when they belly up to the bar, now all little piggies are even par. I don't get bummed, now I don't get bummed. I'm up to the back of the line. I don't get bummed, now I know I'm pumped. I'm at the front of the line. There you go. A little swine management 101.
That was amazing. Thank you everyone for watching this. If you have any questions, please feel free to contact us. Dr. Dan's always willing to talk to students, instructors, classrooms. He's very entertaining, as you can see, and fun to be around. So thank you so much for spending time with us today.
Thank you very much.
Bye, everyone. Thank you.
Mm-hmm.